I'm Dr. Linda Gromco, and this is Transgender Medicine Made Simple. Today we're going to look at masculinizing without surgery, specifically at chest binders and at trans tape. A chest contour that's female can create a huge amount of dysphoria in people who identify as male or as transmasculine. Now, surgery, that is to say gender-affirming chest reconstruction, aka top surgery, is the permanent fix for this issue. But here are some things that can help you if you don't want to have surgery or if you can't have it just yet. A lot of individuals try to dress in a way that will hide their chest contours. And we see a lot of people who will start with a layer of a tank top or maybe a t-shirt, and over that will wear maybe a bulky flannel shirt or a hoodie, something like that. And these can be quite concealing, but they also, because of the layers, can be very hot to wear in the summer or warm weather, and they can be limiting to activities that require a lot of movement of the body. A lot of trans males will typically try to hunch their chest over a bit, and this changes their contour to kind of minimize the appearance of the female breast. But over time, this can make it harder for you to breathe, and it can certainly lead to longer-term problems in your neck and your back and your spine. So certainly this is not a long-term solution. Smaller chested people can probably conceal with Spanx for men or a gynecomastia vest. So if you look up gynecomastia vests on the internet, you'll see something that looks very much like a variety of chest binders that are used by trans males. And in fact, gynecomastia just simply comes from the words gyno, meaning female, and mastia, referring to breast. The frog bra was something that I would see lots of people using in years past. This was a what they would call a major masher bra. It was a running bra, and you would find this on the internet, and it was kind of dysphoria producing for some people who didn't want to identify with the use of a garment called a bra, but it did work. Chest binders are maximally compressive. They are excellent in reducing the size of the chest. They can help treat dysphoria a great deal, but they can be hot, they can limit a person's participation in sports, and they're certainly too constrictive for people who are asthmatics or people who have other lung disease. We saw a lot of people who had difficulty with wearing binders during COVID. You certainly should not wear more than one binder at a time, and it's best to limit the hours of the use of a binder. I would say no more than 8 hours, but if you can, make your breaks frequent.